Hello and welcome to Women and Fertility Health with Dr. Dan Eli Aniku. If you have already gone through menopause and suddenly notice vaginal bleeding, spotting, or even a small amount of blood on your underwear, should you be concerned? The simple answer is yes. Many women assume that a little bleeding after menopause is normal, especially if it happens only once. However, postmenopausal bleeding can sometimes be the first sign of a serious condition, including cancer of the womb. In today's video, I will explain what postmenopausal bleeding is, the common causes, when you should seek medical attention, how doctors investigate the problem, available treatment options, and most importantly, when bleeding could indicate cancer. Stay with me until the end because understanding these symptoms could save your life or the life of someone you love. Before we begin, please like this video, subscribe to the channel, and share it with other women so that more people can learn about important women's health issues. Let's start with the basics. Menopause is defined as the absence of menstrual periods for 12 consecutive months. Most women reach menopause between the ages of 45 and 55 years. After menopause, the ovaries stop releasing eggs, estrogen levels decline, and monthly periods stop permanently. Once a woman has completed menopause, she should not experience menstrual bleeding again. Any bleeding after menopause is called postmenopausal bleeding. This includes light spotting, brown discharge, pink discharge, blood after sexual intercourse, or bleeding similar to a menstrual period. Even a single episode should be evaluated by a healthcare professional. Postmenopausal bleeding is a common reason women visit gynecologists. The good news is that many causes are not cancerous. However, approximately 1 in 10 women with postmenopausal bleeding may be diagnosed with endometrial cancer, which is cancer of the lining of the uterus. This is why every case deserves medical attention. Cause number 1 is thinning of the uterus or endometrial atrophy. This is the most common cause as estrogen levels fall. Cause number 2 is vaginal atrophy. The vagina also depends on estrogen to remain healthy. When estrogen levels drop, the vaginal tissues become thin, dryness develops, and irritation occurs easily. Women may notice vaginal dryness, pain during intercourse, a burning sensation, or light bleeding after sex. This is another common and treatable cause. Cause number 3 is endometrial polyps. These are small growths inside the uterus. Most polyps are benign, meaning they are not cancerous. However, they may cause intermittent bleeding or spotting. Because some polyps can contain abnormal cells, they often need further evaluation. Cause number 4 is endometrial hyperplasia. This occurs when the lining of the uterus becomes thicker than normal. Risk factors include obesity, diabetes, high blood pressure, and estrogen exposure without progesterone. The concern is that some forms of endometrial hyperplasia can progress to cancer if left untreated. Cause number 5 is cancer of the uterus. Endometrial cancer often presents with bleeding as the earliest warning sign. Early detection is critical. This is why no woman should ignore postmenopausal bleeding. Other less common causes include cervical cancer, vaginal cancer, which is rare but possible, fibroids, although they usually shrink after menopause, and certain medications including hormone replacement therapy, tamoxifen, or blood thinners. When should you see a doctor? The answer is simple. Immediately. Do not wait to see if the bleeding stops. Seek medical attention if you experience any vaginal bleeding after menopause, recurrent spotting, bleeding after sexual intercourse, blood-stained vaginal discharge, or pelvic pain associated with bleeding. Remember, even one episode deserves evaluation. How do gynecologists investigate postmenopausal bleeding? Many women become anxious when they hear they need investigations. Fortunately, most tests are straightforward. Step 1. Medical history. Your doctor will ask when the bleeding started, how much occurred, current medications, and previous health conditions. Step 2. Physical examination. A pelvic examination helps identify atrophy, cervical abnormalities, or visible lesions. Step 3. Ultrasound scan. A transvaginal ultrasound measures the thickness of the uterine lining. Generally, a thin lining is reassuring, while a thickened lining may require further evaluation. Step 4. Endometrial biopsy. A small sample from the uterine lining may be collected. This is one of the most important tests because it helps rule out cancer. Step 5. Hysteroscopy. In some cases, a small camera is used to directly visualize abnormalities. How is postmenopausal bleeding treated? Treatment depends on the cause. Examples include